Greetings to everyone. I am Mrs. R. Bhuvana Indumadi, Head and Assistant Professor, Department of Home Science, Sri Sharada College for Women, Salem 16. I am here to explore on the topic diet therapy. This is the paper of the program Home Science, and we are going to deal with the Unit 4, Diabetes Mellitus. Let us see. First, we are going to see about the learning objectives of this Diabetes Mellitus. To know about the insight of the diabetes mellitus, to study about the etiology, signs and symptoms and clinical effects and diagnosis of diabetes mellitus, to plan the dietary inclusions and exclusions of diabetes mellitus. First, we are going to see about the definition. Diabetes mellitus is a chronic disorder that prevents the body to utilize the glucose completely or partially. It is characterized by rise to glucose concentration in the blood and alteration in the carbohydrates, protein, and fat metabolism. This can be due to the failure in the formation of insulin. This is a simple picture to understand about the diabetes mellitus. You can see the picture, the healthy foods which is given here, that is, which is rich in carbohydrate, grains, fruit, milk, which we eat, are rich in carbohydrates. What happens? The carbs has been changed to sugar, that is glucose after digestion. The glucose which enter into the blood and goes to the all parts of the body for energy purpose. Your pancreas, our pancreas senses the rise of blood glucose, sugar, so as to make insulin. The insulin helps the sugar to get into the cells of our body so they can use the sugar as the energy. This is the simple understanding. So when we are taking carbohydrates, the carbs, glucose is converted, carbohydrate which is converted into glucose, the glucose entered to the blood sugar for energy. Pancreas has to release the insulin. With the help of insulin, the glucose molecule which is converted, the sugar molecules, and which is used as energy to our body. Next. And this picture shows about the diabetes mellitus of healthy individual, of type 1 individual and type 2 individual. The healthy individual pancreas, which produce the insulin, the glucose molecule, which has to be attached to the insulin receptor, which control the blood sugar level. When it is in the type 1 diabetes mellitus, we can see the pancreas failure to produce insulin, that is partially or completely, whereas the insulin molecule is failed. In the composition of glucose molecule couldn't able to attach to the insulin receptor, whereas the insulin sufficiency is very less. So the glucose molecule directly dissolves into the blood circulation and produce the high blood sugar level in the body. Coming to the type 2 diabetes, whereas the insulin is completely abruptly not secreting by the pancreas. What happens? Again, the glucose molecules just enable to attach the body an insulin receptor, which is very much reductive to the insulin receptor, and the cell fail to respond the insulin properly. Next. Coming to the prevalence, diabetes is increasingly seen in India. The multi-centric ICMR study shown the prevalence of diabetes is 2.5% in urban and 1.8% in the rural population. 1 in every 8 individual in India is diabetic. The average onset of diabetes is around 40 years, while it is around 55 years in other countries. This is a short comparison of the difference between type 1 and type 2 diabetes mellitus. Types of diabetes mellitus is commonly classified as two types. One is type 1 and type 2. One which is also called as IDDM and NIDDM, that is insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus, and also gestational diabetes mellitus, which is occur in the pregnant cases. So a small differentiation you could see is this is a difference between, that is type 1, they have to depend upon the insulin. It is an autoimmune disease. Type 2, what happens? They has to be depend upon the insulin from the birth till the death. That is, it is a lifestyle disease. Sorry. Now, gestational diabetes. This is an elevated glucose level of the pregnancy. So type 1 is the common disorder, which is an autoimmune disease, they have to take the insulin from the childbirth to death. Type 2, it is an occasional disease, the age disorder, it may be due to the some stress or something. Gestational during the pregnancy time. Here we have compared about two type 1 and type 2. Type 1 is about it occurs at young age. Type 2, it occurs at middle age or elderly. Normal BMI will be the ratio and the people will not be obese. Usually they'll be very underweight. Here, usually the person will be overweight or obese. This in the case of type 1, they will not have any family history. In this, the case of type 2, the genetic consequences will be the one of the familial history usually. And the symptoms we can see, which can be a short duration of the symptoms of weight, which is adjustable and which is immediately known by the short duration of the weight. In the symptoms may be present for months and years, we can able to identify which is the diabetes or it can be present with the diabetic coma, that is diabetic ketoacidosis. Here, the diabetic coma is absent or an insulin is not necessarily required. They can be controlled with the among the tablets and other diet and exercises, etc., depending upon the sugar level of the individual. Here, the insulin is particularly required to the patients. Without insulin, they couldn't able to survive in the case of type 1. Whereas in the type 2, they can be controlled whenever the sugar level suits up with the high blood sugar level for the normal week or for the thrice or twice a week, they can be put on insulin. Previous and diabetic cases of pregnancy, there is or no absolute difference. So what is gestational diabetes? Whenever the sugar level is increased means that is during the pregnant condition, the glucose level is modified or increased or sort of thing has been happened, which is called as gestational diabetes. So after the delivery, the sugar level will be normal. Before that, during the cases of the term condition, they have to take the insulin or the sugar tablets, etc., for the control. After thing, the patient will be obese. In the case of pregnant cases, the patient will be obese in the gestational diabetes. So after delivery, they'll become normal. So what happened? This will be the indication for the diabetes to be happen in the future stages of their life. So now we are going to see about the causes of type 1 diabetes mellitus, that is IDDM, insulin dependent diabetes mellitus. So it is a genetic cause. HLA class 2 gene is responsible for the causative factor of this type 1. Coming to the environmental factor, the important virus infection, the virus which is named as Coxsackie virus, which causes about this autoimmune disorder function. Next is about acute stress. The acute stress, whenever the body respond to respond to immediate stress or something may be irresponsive to the brain, etc. Diet, when introducing the cow's milk before 2 months, which causes diabetes mellitus. Immunological factor is an autoimmune disorder. You can see the pancreas, which is decreased secretion of insulin in the blood vessel, increase the glucose due to the low insulin, the muscle which is unable to use the glucose due to the low insulin. So what happened? The glycogen, the protein breakdown causing ketoacidosis. This is about the causes of type 2 diabetes mellitus, which is nothing but non-insulin dependent diabetes mellitus. Genetic causes due to X syndrome or a metabolic syndrome. Some of the environmental factors are responsible for the cause, that is maybe lifestyle, underactive, maybe obese. Because of the lack of exercise, nowadays people are eating the unhealthy foods. The people are working in a sitting condition, leading a sedentary life, etc. Maybe the environmental factors. And one more, which environmental factor is age. Age couldn't be modified by the time. And abdominal fat. Again, the obesity will be the major causative factor in the type 2 diabetes. In the cases of pregnancy also, that is gestational diabetes, the obesity or the abdominal fat or the waist hip ratio, which is responsible to cause the pregnancy diabetes, that is gestational. Placental hormone will be placing a burden on insulin secretion. And insulin resistant due to abnormal insulin molecule also one of the reasons to cause this type 2 diabetes mellitus. And you can see this picture is the symptoms of diabetes mellitus. This is the initial observation which could include polydipsia, polyphagia, polyuria, and unusual weight loss in type 1 diabetes and obesity in type 2 diabetes. So what is polydipsia? Polydipsia is nothing but increased thirst, which is called as polydipsia. The patient will intake more amount of water and that is called as polydipsia. What is polyphagia? Always the patient will be hunger to eat. That is called as polyphagia, intake of more. Polyuria. Polyuria is nothing but frequent urination. On the night, mostly in the night time, the patient may be urinate in the night time. Poly means many times they feel the urination. Weight loss is unusual weight loss in type 1 diabetes and obesity in the case of type 2 diabetes. These are the initial symptoms which includes. And these are the other possible symptoms. The patient will have a blurred vision, skin irritation or infection, weakness, loss of strength, delayed healing capacity. So sometimes the own healing capacity will be very delayed in the case of type 2 diabetes. These are 7 common symptoms of type 2 diabetes, which she had blood vision and fungal infection in the genital part, and unexplained weight loss and numbness in the hands and feet, frequent urination, constant hunger will be there, and slow healing in the womb. And coming to the diagnosis, some of the clinical laboratory tests are, we can identify by this, that is glycosuria, hyperglycemia, and abnormal glucose tolerance test. And continued symptoms we can see is this fluid electrolytic imbalance, acidosis, and coma. Coming to the brief of the diagnosis, what is glycosuria? It is nothing but presence of abnormal sugar in the urine. So the urine has to be tested where the level of urine is abnormally increased. Level of the sugar which is increased in the urine will be just termed as glycosuria. That is, next is ketonuria, presence of ketone bodies. Ketone bodies will be familiarly seen in the urine. So that can be the identification test which is called as ketonuria. Next is about random blood sugar. That is, the patient has to be identified with the blood sugar test which is more than 200 mg per deciliter, which indicate they have the diabetes. There is a confirmatory test of a glucose tolerance test. This can be tested for the gestational diabetic women also. This is a confirmatory test, whereas the fasting sugar should be 80 to 120 mg and postprandial sugar is 120 to 180 deciliter. So what is glucose tolerance means, whereas the 75 grams of glucose will be mixed with the 100 ml of water, which can be taken in the fasting. After the 2 hours, again the blood sugar has to be tested, where there is an abnormal changes in the level, whereas the fasting should be 120 and 80 to 120, or postprandial should be 120 to 180. So whereas any abnormalities in the GTT, which indicates the diabetes in the case of women, pregnant women. This is the complication of diabetes mellitus, which is we have segregated into acute and chronic. One is diabetic ketoacidosis, hyperglycemia, which is hypoosmolality and hypoglycemia, etc. And diabetic foot ulcer infection is very common among the acute cases. In the chronic infection, which is termed as two depurative part, that is one is microvascular and one more is macrovascular. Micro means the vascular, the veins of microvascular, which leads in the retinopathy, nephropathy, and neuropathy. So retinopathy, which causes the eye damage, nephropathy, which causes kidney damage, and neuropathy, which causes brain damage. So what is about macrovascular means it's the accelerated of atherosclerosis, which is a combined combination of obesity with the diabetes and myocardial infarctions, stroke, and extremities of gangrene. So most of the heart disease can be felt with the diabetes in the combination. That is, blood vessels will be dilated. Okay. Next is lower extremities gangrenous. The lower foot part or the lower extremities will form the wound infections or wound healing. Next, come to the dietary management with the guidelines. This is the principles of diet: a moderate carbohydrate and high protein and low fat, high vitamins and minerals and high fiber should be followed by the patient individual. The daily energy intake must be estimated on the following facts, that is age, and sex and weight, and depending upon the activity, whether they are doing sedentary or a moderate and a heavy worker, the energy level can be opted and transmitted. Outline of this dietary management. One, to treat the goal is treatment and component of diabetic diet. And nutritional intervention, we have to assess whether they are type 1 or type 2 or gestational diabetes. So depending upon the condition of types or the classification, we have to estimate the diet chart and diet plan. So we have to accuracy of body weight management is much important in the weight management system, and also the diet planning assessment. Coming to the carbohydrate, we have to know about the types, glycemic index, exchange of food systems such as fruits and vegetables and high fiber foods. And protein rich diet can be taken, and dietary fats and cholesterol, which is important with the obesity, with the combination of diabetic patient, and salt and high sodium foods, and considerably alcoholic and alternative sweetness can be taken as a diabetic food. And first, it is treatment of diabetic diet as a goal. We have to optimize the blood glucose control. We have to achieve and maintain the reasonable body weight, and optimize lipid and lipoprotein profile, and reduce the blood pressure level, prevent or delay the progression of chronic complication, promote overall health through the optimal nutrition. And nutrition recommendation for diabetes management. There is no one diabetic diet that suit all, which is already told. Depending upon the classification of the types, we have to suit the diet for the individuals. So modification of a normal or a well-balanced base nutritional need of the individual, that can be expressed in the total calorie or in the ratio of fat or protein and fat. So each patient of diabetic should have a different diet. Setting up a diabetic diet, first we have to calculate the caloric need of the individual, and determining the dietary contributions, that is distribution of protein, fat, and oil, and dividing the daily prescribed practical thing of a healthy meal. And this is about the energy requirement. I already stated that depending upon the activity level, we have to give the energy needs. So depending upon the weight status, we have to assess the energy needs. Here we have been compared with the obese condition and the activity level. While comparing to the obese BMI of 30 and above, and the activity level should be 20 and 25 and 30, and the energy level should be 20 and 25. So accordingly, we have to plan for the overweight, normal, and underweight. The calorie allowances can be decreased with the age. For as 18 to 39 years is above, and 40 to 59 years, which is above than 5% less than the more, and 60 years, which is 10% less than the above. Coming to the nutritional needs of strategies, we have to distribute the food throughout the day. That is, the patient should have the small and frequent meal, appropriate spacing of time, and 4 hours in intervals to be taken of food. And the patient has to choose the healthy carbohydrate, protein, and dietary foods. And type 1, for the case of type 1 diabetes, the food distribution should synchronize the insulin therapy, because the patient will be put on the insulin. So most of the people will need 3 main meal and 3 snacks meal to avoid the hypoglycemic status. Coming to the overweight or a type 2 patient, the calorie should be restricted to 1200 to 1500 calorie, and 3 main meals should be there. The snacks are usually not required. Coming to the ideal or underweight type 2 diabetes cases, 3 main meal with a small mid AM meal and a PM meal, that is for mid-morning and mid-evening snacks can be taken for the ideal body weight type 2 cases. So there should be a consistent and variety of dishes can be prepared by consistent eating of dietary habits to be followed. We have to try to eat same amount of food at the same time and include a variety of foods. And we should keep the space on our plate. That is, this is just a combination of my plate diet. It should be a vegetables of 2/3 kinds at least. The 1/3 part should be a starch or potato or a pasta. Anything can be there. The protein-rich diet can be the other 1/3 part with the milk, and any of the fruit can be plated on your space of a plate. Coming to the dietary consideration, we have to calculate or distribute the carbohydrate should have 60 to 70%, and calorie should be 60 to 75%, and carbohydrate should be 15 to 20%, and from protein it should be 15% to 20%, and from fat it should be 15 to 20%. So coming to this thing, we have, if there is no insulin, calorie distribution of each meal can be distributed as 33% of every 3 meal. That is, breakfast and mid-morning should be 33%, lunch and tea should be 33%, and dinner and bedtime can be 33%. So by this equal distribution, whether the no insulin is not, for the cases of patient, we can be distributed at 33%. And the patient is taking insulin, the calorie intake or all the 3 meal can be added according to their activity. Simple sugars should be avoided. Calories should be adjusted to the insulin patient. A mixture of oil can be preferred. The single oil, that is, the oil can be rich in PUFA, that is polyunsaturated fatty acids, or addition of monounsaturated fatty acids can be added upon. High protein diet helps us to increase the insulin production. Complex carbohydrate and fiber should be included in the diet of 25 to 40 grams of dietary fiber is suggested per 1000 kilocalorie. Water-soluble fibers may be the greatest thing to reduce the hypocholesterolemia, hypoglycemic, which include the whole grain legumes and fenugreek seeds. Timely intake between the meal snacks to prevent hypoglycemia should be followed by the patient. Here, the patient should avoid fasting or feasting. That is the one of the main goals should be the patient should not fast or should take the feasting. Sodium should be restricted for the hypertensive patient, that is diabetic patient. And instead of simple sugar, many of the artificial sweetness can be suggested, just non-caloric sweetness can be suggested to the patient. Junk food should be avoided. So some of the foods of the inclusion dietary thing or exclusion dietary thing, these are the foods to be avoided, like simple sugar, like honey, syrup, or glucose, sweet, dry foods. This picture just clearly shows about that cake, candy, fried foods, alcohol, nuts, jaggery, sweetened things can be avoided. This is a top worst food for the diabetic patient. And these are the foods to be eaten in the moderate, that is fat, cereal, pulses, meal, fruit, and artificial sweetener can be taken in the moderate consideration. And these are the foods can be permitted, and these are the 5 live superfoods can be taken, that is vegetables and fruits and other plants and liquids of all plain green tea and other all sources. And lean protein is suggested to the patient, and unsaturated omega-3 fatty acids like olive oil, coconut oil, and other oil, etc. And organic wholesome grains can be taken by the patients. Here, foods are permitted as green leaf vegetables, fruit except banana, lemon, clear soup, onion, mint, salad, plain coffee or tea, skim milk, buttermilk can be taken. Okay, let us review what today we have seen is about diabetes mellitus. What is diabetes mellitus? The body does not produce enough insulin. The body cells are not receptive to the insulin being produced. Coming to the complications, fatigue, dehydration, damage to the vital organ have been seen. And ways to manage is the 2 ways, is one is diet and exercise. Coming to the conclusion, hence, to conclude with a proper diet, exercise, drug, medication, education, diabetic mellitus can be managed, survive without macro and microvascular complication. Thank you all for listening. Thank you, Anand.